The GOTA membership committee compiled a list of 10 resources created by various organizations in response to the COVID-19 pandemic. We hope the following 10 resources help occupational therapists through this difficult time.
Telehealth and COVID-19 Town Hall, featured during the Atlanta Regional Town Hall during the beginning of the month. Telehealth access expanded rapidly in response to COVID-19 from a federal waiver. A few of the notable changes include state approval for telehealth, waivers for HIPAA, allowance of verbal consent, and billing modifiers. As indicated during the April 2020 Journal Club, veterans have access to OT clinicians regardless of state licensure location. Reference Kelsey Reeves' Journal Club video for link to the article reviewing evidence-based interventions in telehealth. We look forward to seeing how licensure pact changes will allow specialty clinicians to provide services across state lines. For more information, check out the videos featuring Aileen Diagracias and her team. Demonstrating true crisis leadership, the American Occupational Therapy Association lifted the membership wall related to COVID-19 topics. In a statement to the public, the AOTA announced, amidst the COVID-19 pandemic, occupational therapy practitioners and students are faced with unprecedented challenges impacting their psychosocial well-being and mental health. AOTA believes that it is crucial to support our professional community by offering tools and resources to assist with coping during this time and beyond. We encourage all clinicians to assess their resources. We have included a direct link to the state-by-state telehealth statutes below. Recognizing the impact of recertification during a pandemic requiring social distancing, the American Heart Association is waiving expired CPR cards for 120 days to ensure clinicians can still provide essential services while appropriately licensed.
Sewing Masks for Atlanta Hospitals is a grassroots organization that has had over 400 volunteers spending their time and resources to sew masks that cover Atlanta healthcare workers. Their goal is to help Atlanta hospitals and preserve PPE by sewing masks to act in tandem with traditional surgical and N95 masks. Atlanta isn't the only region in the state with this group. Each area has their own organized entity. Connect with organizers on Facebook or via the websites found below to find out if your hospital has already partnered and if you can forge that relationship. Okay. The Research, Engineering, and Assistive Technology Society of North America has created a decision tree for clinicians to utilize when trying to decide how to address clients' needs during a pandemic. In response to the unprecedented number of students without access to their technology software, Freedom Scientific is offering free software to students. JAWS, Zoom Text, and Fusions are offered for free for students with a valid email address.
RESNA made our list a second time due to their extensive resource list pertaining to assistive technology, telehealth, and COVID-19. RESNA updates their page often, pulling across disciplines and practice areas. The Accreditation Council for Continuing Medical Education boasts a comprehensive resource list divided out by organization and practice population. Many clinicians are getting pulled from their specialty area of the hospital to treat patients they are unfamiliar with on another unit or clinic. On top of all of that change, there's a high probability the patients may also have COVID-19. CME has you covered. Look up the practice area and learn about how COVID-19 impacts that population. What's the recommended treatment response and topics you should be aware of unique to that population. Medbridge is offering a COVID-19 compliance course series. All 7 courses are free. Therapists should make sure to check out cleaning and disinfecting of medical devices and equipment. Keeping ourselves and patients safe extends well beyond hand washing. Make sure you're cleaning your equipment properly.
Finally, we want to recognize all the creative ways the community has pulled together to support all essential workers. The volume and variety of essential worker appreciation offerings is amazing. Discounted food, bulk deliveries to hospitals, cheering, luminary displays at night, and letters of gratitude are just the tip of the iceberg. One of our favorite lists is from ThoroughList, and it's the free food list. Support local while enjoying discounts showing the community's appreciation. See the link below for the article. Thanks for tuning in to the GOTA Membership Committee's COVID-19 resource list. Comment below to share your resources that you found supportive during this difficult time.